Hi, I'm Dr. Keri Elliott, and I am a veterinarian. I'm going to begin a video series on animals and common diseases they get. This video series is primarily to help educate owners about the issues that their animals are going through and give them a better understanding. So come along and join me and let's get started. Welcome back. I'm Dr. Keri Elliott, and today we're going to talk about heart murmurs. When we think about heart murmurs, we think about the abnormal sound that the doctor hears when they listen to your pet's chest with their stethoscope. So how that translates is if you think about a river flowing along, and it's nice and quiet. Now when the riverbed gets shallow and rocks come up towards the surface, you hear the water going over it. And that's what a murmur essentially is in the heart. So normally the blood flows through the heart nice and smooth. But if there's an abnormality in either a vessel or a valve, you're going to get a murmur or a rumbling sound. Common sounds that we hear would be lubsh, dubsh, lubsh, dubsh. A normal heart sound is lub, dub, lub, dub. So anytime we have anything other than that, that's what we call a heart murmur. When we think about heart murmurs, there's two different kinds of heart murmurs. You have a physiological heart murmur. So this is a heart murmur that doesn't necessarily lead to disease. A physiological heart murmur, it can be caused by dehydration, it can be caused by anxiety, it can be caused by anemia, it can also be caused by certain metabolic issues. A pathological heart murmur is caused by either a diseased valve or a disease in the heart itself. So today, we're going to primarily look at that, and we're primarily going to talk about it in dogs. Cats are a whole other species. So when we're looking at a dog with a heart murmur, I'm going to look at, is it a young dog or is it an older dog? Young dogs with heart murmurs often have these as congenital heart murmurs. That means they were born with them. Often that can be a change in the way that the heart formed when they were in utero, or it could be a disease process like heartworm disease. Often whenever it's an abnormal formation of the heart or a congenital heart murmur, they can either outgrow it, which is most common, or sometimes they need intervention. When we talk about intervention, that means taking your pet to the cardiologist. So when they go to the cardiologist does what we call an echocardiogram. So they take an ultrasound of the heart, and they look at all the vessels, they look at all the valves, and they see how the heart is working. They determine exactly what's wrong with the heart, and they develop a plan to fix it. So if that's the case, speak to your veterinarian, and they'll get a referral to a cardiologist. Often, the most common heart murmurs that we see are in older dogs. And these dogs, as they get older, their heart changes. Now, what does that mean? When we look at the heart, we look at how the blood flows from one chamber to the next. So from the atrium to the ventricle on the right side, then to the lungs, and then from the lungs back to the atrium, and then into the ventricle, and then out to the rest of the body. So in between each of these steps, there are valves. And as dogs get older, these valves can change. As the valves get thicker, then they can't close properly. And when a valve can't close properly, you're going to have a leak when that heart beats. So that lub dub that we talked about before, that is the heart valves closing. So lub, there's your atrial valves closing. Dub, there's your tricuspid valve and your mitral valve closing. So as the pets get older, those valves change a little bit. They get a little bit thickened. And when that happens, then they get leaky. And when you get leaky, instead of lub, you got lubsh. Or dub, you have dubsh. So when they get leaky, that allows blood to go backwards. It should be going one way. When that blood goes backwards, then you can get a change in pressures in the heart as well as the lungs. The most common presentation of heart murmur, in my experience, is cough. The pet comes in and it's been coughing a little bit more when it wakes up, or it's been coughing a little bit more when the UPS man rings the doorbell. Hi, we're back, and we're going to take a little bit of a closer look at inside the heart. So we just talked a little bit about heart murmurs, and when we were talking about heart murmurs, we discussed that the blood flowing through and how as they get older and the pet's valves change, that can result in a buildup of fluid, maybe in the lungs or in the liver, depending on which side of the heart it happens. So we're going to look a little bit at the heart and how the blood goes through it. This is a lovely picture that we got off of alldiagramblogspot.com. So if you'd like, you can visit there and see this lovely diagram. But essentially, blood comes from the body and it goes into the right atrium through the vena cava. From there, it goes through the nice tricuspid valve into the right ventricle. And from there, it goes into the lungs. You can see right into the lungs, and then it gets oxygenated when it's in the lungs. As it leaves the lungs, it enters back into the left atrium. From the left atrium, it goes through the mitral valve into the left ventricle. And from the left ventricle, it goes out into the aorta and goes to the rest of the body. In older dogs, the most common area of degenerative valve disease is in the mitral valve. Mitral myxomatosis disease is what it is called. And what happens is this valve right here gets a little bit thicker. And when it gets a little bit thicker, it doesn't close all the way. So when it doesn't close all the way, the blood, instead of going out into the body, when the heart beats, it goes back into the lungs. So then you have blood coming from backwards from the left atrium into the lungs, as well as from the right ventricle into the lungs. So then the lungs gets too much blood in it, and that blood squeezes into the little alveolar space. And that's something we call pulmonary edema. So hopefully this little review of cardiac physiology will help you to better understand your pet's heart disease. And then they get a cough. And so that's the most common presentation that I see. So when that happens, we talk about getting chest x-rays so we can look at the size and the shape of the heart. We talk about medication needed depending on what we see on the chest x-rays or radiographs. So when this happens, it's important to consult with your veterinarian about what you think the causes are and if you think that your pet needs to see a cardiologist. Once you've established a relationship with a veterinarian and have a good understanding of your pet's heart disease, one common way that you can monitor your pet is at home. When they're sound asleep, counting their resting respiratory. When your pet is sound asleep, laying on the ground in front of the TV or laying next to you in the bed, count how many breaths they're taking in 1 minute. If they're taking greater than 30 breaths per minute while sound asleep, that is cause for concern, and you need to see your veterinarian as soon as possible. Again, that's 30 breaths per minute while sound asleep. So taking the sleeping respiratory rate, that's 1 breath. So every time their chest goes up and then goes back down, rises and falls, that's 1 breath. So do that for 1 minute and count how many breaths they're taking. If it's greater than 30, they need to be seen by a veterinarian. And you should give your veterinarian a call so they can maybe recheck your pet or adjust their medication. So hopefully this little video has been very informative for you as far as heart disease goes. We're producing additional informative videos to help you understand your pet and any diseases that they might have. Thank you.